Thank you, Jennifer. I really, that sets the stage perfectly for our next panel. It's just wonderful to hear from an organization that is so proactive in their strategies to educate employers, but also so thoughtful and deliberative around their fact-based gathering and research, and now their advocacy as well. So thank you, Jennifer, for that great presentation. I'd like now to call up our panelists. Irina Vyazunova, who is a family caregiver and senior research scientist from right here in Madison at the Promega Corporation. Greg Olsen, acting director of the New York State Office for the Aging in Albany, New York. Kim Falk, Respite Employer Engagement Coordinator with the Munroe-Meyer Institute at the University of Nebraska Medical Center in Omaha. Lynn Gall, Family Caregiver Support Programs Manager. You've met Lynn earlier today at the Bureau of Aging and Disability Resources in the Wisconsin Department of Health Services. And she also is co-chair of the Wisconsin Family and Caregiver Support Alliance Employer Engagement Work Group. And Diana Clark, Benefits Manager with Human Resources at Promega Corporation here in Madison, Wisconsin. So welcome to our panelists, and we're very eager to hear about your data gathering and solutions. Thank you for being here.
Is this on? Oh, yes, it is. Hi. Can you put the slides on, please? Okay. So as Jill mentioned, I am an R&D scientist here in Madison, and it's part of my job to give presentations all the time, and usually only 5 people in the world understand what I'm saying. So it's kind of refreshing to actually talk to a lot more people that will understand what I'm saying. But also, I recently scanned my family albums, all the pictures from back in the day. So you guys have to suffer a little bit watching. So this is my family and me, kindly pointed with an arrow. I grew up in Moscow, Russia, which is very far away, and many years ago. So next slide, please. And this is my dad and me, again, many years ago. And my dad lived independently for a long time by himself in Moscow after my mom passed away. And then about 7 years ago, he unexpectedly moved in with us. That's a separate story for a different conference. And next slide, please. Well, sorry, I'm skipping, but that's my journey. I went from Moscow to Cedar Falls, Iowa, and I put the populations there just for you to imagine kind of the culture shock that I experienced. And then from University of Northern Iowa, I moved to Madison to do my PhD, and that's where I met my husband. Next slide, please. And once my dad moved in with us, we became a household of 3 PhDs. We didn't really expect that our next stage will be caregiving, but next slide, please. That's what happened. So once my dad moved in with us, he was diagnosed with 3 kinds of cancers in 3 months, and many surgeries and multiple treatments later. In that same year, I went back and I realized that I took 120 hours of leave, and that's on top of flexing. So my work is extraordinarily flexible. I can work at any time. My supervisors, Promega in general and my supervisors in particular, very understanding. But at the same time, that definitely was very, very stressful. I was running out of my vacation time, of my sick leave, and my friends were prepared to donate time to me because there's a program like that. And to kind of echo what Jennifer said before, when I approached my supervisor asking if I should file for FMLA, he said, oh no, it's okay, you don't need to, we understand. And then I was like, maybe I should. So I talked to Diana, who's going to talk later, and she said, of course you should, but also wink, wink, expect some good things coming your way. Promega is going to offer something spectacular for you. And that I learned that was going to be caregiver leave. And we started with 80 hours, which is 2 weeks a year. Which was just revolutionary, honestly. Nobody expected that was going to happen, and that totally changed, made a huge difference for me. And now, what is it, 6 years later? Just recently, a few months ago, we increased to 240 hours, which is, I can't express really in words how much that means. Especially since in my situation on top of, well, my dad is a cancer survivor, he's in remission, so that's not a concern anymore, but he's been diagnosed with dementia. So now that's what my caregiving is. And my dad doesn't speak English, he doesn't drive. And my husband doesn't speak Russian. So he is very helpful. My husband is very helpful, but there are certain things that he just cannot do because of that. So all the driving, all the medical appointments, it's all me. And that's the story. And next slide, please. So that's what we do. We spend time. I live next to Pope Conservancy for people who are from Madison. And because, next slide, please. And that's for the, everybody who looks at my presentations knows that I have a dog picture always. So we love our dog, and my dad loves him too. It's his best friend. So that's it. Thank you. Thank you for having me.
Up, it's on. Oh, there you go. All right. Well, in typical New York fashion, I'm going to bomb through this because I think I have about 8 minutes. But I first just want to thank Jill for the invitation. Shout out to Doris Green from the New York State Caregiver and Respite Coalition. I will start building my dog picture into my presentation as well. And Jennifer is not my sister. But I think what she talked about was really what I'm trying to get at. So I've been in aging for 30 years. I'm a geriatric trained social worker. I've provided direct practice to individuals and families, provided respite care to individuals, and now, for 15 years, I run the New York State Office for Aging. I've done a lot of things in between around aging, including community organizing. And I think some of the data that Jennifer had talked about is exactly what we're trying to do in New York State, because I think your last slide was the most important. What can businesses do? You have to build a political and policy movement around this issue. I often say that, and I don't talk about just respite care because there's direct care for caregivers and indirect care, and we do all of it through a very vast network, but we need to be doing a lot more, and this is an issue that needs to come out of my agency, and that doesn't mean that we're not always going to be supporting older adults and their families, but it needs to rise to the governor's level, and hopefully with the RAISE Council, rise to a national level where it becomes institutionalized into everything that happens, because whether you're talking about healthcare, caregivers are key to that. They're the #1 providers of long-term care and the #1 providers of social services, and there's a reason there's 10 million jobs available out there that the private sector has yet to get, and that's what we're trying to address in New York. So next slide, please. So I'm going to talk about our initiative. Many of you may have seen back in the day, in the 90s and in the early 2000s, the MetLife Mature Market Studies that showed that the cost of caregiving cost businesses $70 billion a year. So as a social worker, I love numbers and I love data because I can make them talk and do the types of things that we need to do. And I think Jennifer's data, coupled by the data that we are pulling in New York, you need to get, well, not you, I'm talking again for New York. We need to elevate this so that it's an all-hands-on-deck approach and not, a particular industry like human services or healthcare or what have you. So, you know, a couple of years ago, I'm like, I want to replicate these things in New York and start to aggregate the data in New York, bring the businesses in so that we can elevate this into a New York State priority from the governor's office down and get us all rowing in the same direction on how we actually put in interventions to address this, but you can't do that without understanding what the problem is first, or at least what the data says, because caregiving isn't a problem, but there are manifestations, as we see from Jennifer's data, and you're going to see from mine, that this data is a call to action. If you see it and you sit back and say, okay, yeah, well, you know, I see that, and boy, that's overwhelming, then you got to find something else to do. This is a call to action data that should really scare us all. Next slide, please. Next. Keep going. Okay, so you all have access to my slide deck. I believe it was posted, so that's why I'm going to kind of bomb through this. But some of the key things, there were 2 studies that the CDC put out during the pandemic, which were really, again, an aha moment, particularly for me, right? And some of it Jennifer has talked about, and I've heard through this conference so far. 90% of HR departments know they have an issue but don't know what to do. Now, in an organization like mine, I got 150 employees. I know every single one of them. 25% of my agency are active caregivers, including myself. And if I don't know that in a leadership position, certainly my supervisors do, or the other staff that I interact with do. So this isn't something folks don't know, but HR departments, when I talk business, I'm talking public sector and private sector, all inclusive. They don't know what to do, but they want to do something, and 70% of employees go to their HR departments to talk about personal issues or problems. So there's a unique opportunity in that. But when you look at some of the things that the data showed, right? 85% of caregivers with children, that was me, and caring for an older adult contemplated suicide or had suicidal thoughts, right? I mean, that's pretty scary. 52% reported suicidal thoughts. I'm sorry, I haven't been to the eye doctor since the pandemic started. 85% experience a mental health symptom. 75% trust their employers, et cetera, and much of the data that I think Jennifer presented was in the CDC study. If you flip to the next slide, you'll see a huge increase, not surprisingly, alcohol and drug abuse, substance abuse, using food to cope, right? How that makes you feel, your physical abilities, your own health, et cetera. And then some of the data, again, that Jennifer talked about, taking leave of absence, switching to part-time, full-time, and 10% left the workforce completely. That's national data, and that should scare us all, and it does scare me, which is really why we launched this project, but the project was launched just before this. Next slide, please. So what are we trying to do? And this is the data from ours. Elevate this out. We need to get the data from the businesses, and we have a couple of ways to do that. I first want to thank the University of Wisconsin because we used their study, and Doris helped us do that, to start to get to businesses to pull the data in. Who'd we get to? Volvo International, JP Morgan, county-based organizations, worked with our Association of Counties, et cetera, to really get a lot of data. But that study ended, or the survey ended in November of 21. So we replicated the study, and we're going to keep it open because we have a lot more that we need to do. We have partnered with organizations like Archangels. If you haven't heard about them, they have a caregiver intensity index. I encourage you to take a look at that. Less than 2 minutes to figure out, are you in the green, yellow, red, how you go from red to yellow, yellow to green, and then connect with resources. We partnered with Trualta and are subsidizing 100% an evidence-based platform and intervention to support caregivers and so many more things. But this is the data from New York. And again, it matches exactly what Jennifer was talking about. Employees are providing daily support. You know, we used to think that the average caregiver was a 63-year-old female caring for an older adult. Certainly females are huge blocks of caregivers, but they're not anymore. 50% are men. And I find as I look around the room or when I talk to people, and not surprisingly, I'm the only man on the dais as well, we need to get this into departments of transportations and public works and places where men also are being able to tell their stories, because it has always been a longly held belief it's a women-dominated issue, but that's changing. We also can see, again, by Jennifer's data and ours, we have a huge millennial population caring for somebody. Big Generation Xers, and in New York we have 350,000 grandparents taking care of grandkids. So it's a family issue, it's across the age spectrum, and it matters. But we're seeing the same exact things. Employees are caring for individuals, many, many hours a day. They're doing the same things. Not taking a promotion, which impacts your long-term economic security. Going from full-time to part-time. Leaving the workforce altogether. Or how about your productivity? So if I'm taking care of somebody who has dementia or is in severe pain and is up all night, and I come into work the next day, how productive am I going to be? Or am I coming in late, leaving early, making phone calls, dealing with emergencies? All of those things are happening. I've done it myself, so have my employees. Luckily, we're an organization where, if somebody says, hey, Greg, I need to take some time off because, and I'm like, you do that. Family first. Everything else can more or less wait. But not everybody's in that space yet, and I think that that's where we need to get to. Next, please. Just some of the, again, some of the data from ours that really mirrors what Jennifer talked about. You're talking about arriving late, leaving work early, missing days of work, unable to focus at work, responding to emergencies, turning down promotions, considering changing employees, consider leaving work entirely. And then the types of information people want are snippets of information, either verbally, audio, or written. And that's why we partnered with TruAlta, because those are the three mechanisms that caregivers have access to when they need it, where they need it. In addition to, we run our ADRC in New York called New York Connects. It's a 5-agency system reform that we oversee. We get quarterly data dumps from the health department, mental health, substance abuse, and Office of Persons with Developmental Disabilities along with us. We have over 135,000 caregiver and respite programs throughout New York State. But as many of you know, we're a crisis-driven system. People don't need you until they need you. And I think the number one thing is that we got to come up with a different word than caregiving, caregivers, because that's not, people don't self-identify. And that's the number one, that's one of the number one problems. More than half of people don't call themselves caregivers. What do they call themselves? Sons, spouses, daughters, aunts, uncles, grandparents. So it's an industry term. We all know what we're talking about. But the general population doesn't. I think I got one more slide. Thanks for bearing with me. So here's what we're doing. We created a guide for businesses with the Department of Labor. They have been outstanding partners. 90% of businesses in New York are small businesses, so they're going to know what their employees are dealing with for the most part. And we've now updated that. The Department of Labor has sent it out to their entire mailing list twice. Be more than happy to share that with you. We are continuing to survey businesses throughout New York State. I'm working with the governor's office to survey state employees. It's very hard to help somebody else if we're not helping ourselves first. So I'm working to do that. We've partnered, as I said, with Archangels on the Caregiver Intensity Index. We've funded for the entire state of New York, and if anybody wants to know how much that cost for our state, it's going to be way less for your state, but we're fully subsidizing it. And it's free for everybody. And then I talked about the New York Connects resource guide and searchable database. Next, please. So what's next for us? Continue to gather data, multi-agency push to get the data out. We do Facebook Lives. I reach about 10,000 people every episode to be able to get these resources out. Continue to speak with workforce development boards, businesses, health insurers, anybody that will listen, because anybody that owns or works in any type of business is going to be dealing with this, regardless whether you have 3 employees or 3,000 employees. We are funding an Any Care Counts campaign with the Ralph C. Wilson Foundation, the Health Foundation of Western and Central New York. I'm putting some money in and some others so that we can help people self-identify. And then one of the things that I'm really excited about is, as a state employee, I'm required to take 13 mandatory trainings. Everything from sexual harassment in the workplace to IT security to ethics, et cetera. So I'm developing a 15-minute training that can be used both in state government or for any business that will, again, help individuals self-identify as caregivers due to the tasks that they're performing, and then connect with all of those resources. This project cost me nothing. It was me picking up the phone and calling my partners and asking them to participate. It would be great if you could replicate these types of surveys, that Jennifer now has some national data, and if we had 50 different state data that look just like ours, then we take it out of the New York State Office for the Aging. It's at the governor's level in New York, but it becomes a federal priority that can be built into the RAISE Council all the states that are looking at age-friendly or master plan on aging and all the other types of things. This can't be a sideline issue. Turn the rock over, shine a light on it, and let's get something, you know, organized on a national scale that can finally get the resources both on the respite side, but also on the workforce and service side in the community. That's going to help the people that we all serve and care about.
Hello, everyone. My name is Kim Falk. I am with the Nebraska Lifespan Respite Network based out of Munroe-Meyer Institute in Omaha, Nebraska at UNMC, University of Nebraska Medical Center. And I don't want to sound repetitive, but I do have to say a lot of what Jennifer and Greg have had to say are things that we are doing in Nebraska also. Greg, you've blown me away and inspired me to do even more. But in 2015, actually, Nebraska, the Nebraska Lifespan Respite Network, we started what was called our Respite Employer Engagement Initiative. We received ACL funding to do a Respite Employer Engagement pilot project. And the network contacted us at Munroe-Meyer Institute. We house the respite coordinator for the Eastern region. And they visited with us because we are one of the largest employers in Nebraska to start feeling out how we can best reach working caregivers through their employer. So over a 3-year period, next slide please. Over a 3-year period, we did that, with our objective being to evaluate the impact of employers sharing and promoting respite resources to their employees. And during this time, we wanted to feel out, how are we going to do that? What was the best way to reach employees? And also figure out what was best for different size employers across our state. We have UNMC, where we have 15,000 employers, and then we have the mom and pop grocery store that might have 3 employees. So, you know, just being a more rural state, we wanted to reach everyone. So during this time, we developed a lot of products. We started with brochures, flyers, information for websites. We did lunch and learns. We attended new hire orientations at UNMC in Nebraska Madison. That was 3 a month for 3 years. We added information to our website, which was very helpful. But we also partnered with the UNMC Human Resources and Public Relations departments. So they were on board with helping us. And we started with them by first proving the baseline of who knew what respite was. Respite or respite, as Charlotte said yesterday. We were all in that same situation, which is why the network wanted to do this employer engagement project. But we partnered with them, and they were very much on board in supporting us and helping us reach out to different departments, different management levels, even partnering with our employee assistance programs and wellness programs became very helpful and has continued to be helpful post-pandemic. But with that, we came up with a lot of products and the way we were going to reach employers with a model for replication that we could train our different respite coordinators across the state. Next slide, please. This is just an example of what the information that we provided on our website. And we wanted to keep it really basic. I know yesterday we mentioned, or Charlotte might have mentioned, talking to people like they're in kindergarten. But it was just once again, and Greg also mentioned this, we reiterated the definition of respite, that it's a break for an individual who cares for someone with disabilities, chronic health care conditions, or aging parents or grandparents. And also want to reiterate what a caregiver is. Because as Greg said, nobody identifies. You know, even me, I'm a mom. You know, I'm not a caregiver, I'm just a mom. So we wanted to make sure that we're pointing that out. And when people go to the website, they can look and see, oh, yes, I am a caregiver. I do deserve a respite break. So yes, I am in the right place. Or maybe this would also identify that, clarify that maybe respite is not the right thing for them. We also have our respite website link available, and we don't have to go to that right now, but we want employees to be able to go to our respite website 24/7, access any resources they need, whether they are an employer, whether they are a caregiver looking for respite, whether they want to apply for respite funding, all of it is right there for them to use. So we encourage employers to do that. And something else that we wanted to provide for employers, like offering, we offered examples. They can put this particular page on their website with their own branding, of course. We can give them our brochures. What we wanted employers to realize is they did not have to take on extra responsibility. They were just the person to pass on the message. Respite is available. There are 12 different funding resources available in Nebraska, and we, the network, can take it from there. They just share the information with their employees. Next slide. This particular slide, I just wanted to mention, Jill brought this up when we were discussing our presentations. But during our pilot project, Dr. Rosalynn Johnson at Munroe-Meyer Institute, she is the director of our education department who does a lot of program evaluation, and she evaluated the respite programs in Nebraska. And this is one of my favorite slides from that particular evaluation because it shows straightforward the improvements of negative health symptoms that caregivers were experiencing, but once they had respite, they all improved. And that happened from across the board. And just being able to show an employee data like this, it's very meaningful, and they take note of that. I will also mention that besides this particular question, there was a question about what happens when respite was taken away, and that was delivered over a 3-year period, and all health symptoms got worse. So it is, I mean, just something that you think is such a little thing like respite, it really does have a big impact. Next slide, please. So what is the employer's role and why should they matter? I mean, I do have to say that employers have been very open and very interested in learning more about respite and offering respite information, but sometimes you have to have a little bit of a selling tool. And one of my favorite quotes is from AARP's Valuing the Invaluable report from 2019. And we've heard some of this already, that 1 out of 3 family caregivers report having to drop out of the workforce, reduce their work hours, or start receiving bad evaluations on their job performance. And when employers can start thinking about that yes, this could be really impacting, my company, my business, and my employees, then they do take note. But overall, like I said, I've had really good feedback. And then post the pandemic, oh my goodness. I mean, we're in a workforce crisis. So employers are taking note of this, and they want to keep working caregivers on staff if they can. Next slide, please. 2 years ago, we participated in a webinar with the Arch with the University of Wisconsin-Madison and they Division of Extension, and they were sharing information about their employed caregiver survey. Right away, the Nebraska Lifespan Respite Director and myself thought this was the next step for Nebraska. We need to get feedback from employers. We need to be able to give them data to show them how having working caregivers on staff can be impacting them and what they can do to support them. So we started doing the Nebraska Working Caregiver Survey 2 years ago. And we do promote employer benefits, that employees, they are reducing absenteeism, they are retaining quality employees, they are developing better relationship with their employees, so hopefully they keep employees on staff. But even the bottom line impact, besides the 1 in 3 working caregiver quote, they didn't realize the dollar amount of employees not being at work each year. That we have 126 million workforce absences each year, valued at $25.2 billion. So that's something that employers are like, oh yes, this really could impact me. But I would encourage you, as Greg said, New York is also participating in this survey, but the University of Wisconsin-Madison is very welcome to share these resources with you if you are interested in participating. Next slide. So this is just an example from our working caregiver survey, some questions that many employers take note of. We developed a data report through our program evaluation department at UNMC. We wanted to have a data report that we could share with employers, that they could get information that was straightforward, easy to read, easy to understand, and kind of know what they could take away and do, what they could do with it. So these are just a few examples here. But respondents report, how caregiving has impacted their job, whether it's arriving work late, missing work, all of those kinds of things. We also have a question about that 40% of the caregivers, and I should mention this data is from our last 2 years, so our overall participation, 40% of the participants, which we've had almost 1,000, said that being a caregiver has made work more difficult, and then also over 60% are the primary caregivers for the individuals, so their job is 24/7. Also, another point that many employers like to hear about is what they can do to support their working caregivers or what information they can provide. So things like legal obligations, community services, these are all things that are frequently mentioned. But we give this information to employers so it's easy to read, easy to understand, and something that they can take away from this. The Nebraska Lifespan Network is also doing what we can, taking note of this data and knowing what we can do to better support caregivers. We know we are respite. We're funded to provide respite, to help families, find a care provider, get respite funding. This is what we do. But if we can partner with other businesses or organizations across the state to better inform caregivers about resources, if we can add something to our website, if we can do co-presentations or Zoom meetings with other people, we want to do that to help support working caregivers in Nebraska. But overall, I do have to say that our steps are going very well. We are very pleased with the results. The network has continued even after our pilot project. We have obviously continued our program. They continue to contract us every year. But we look forward in what else we can do, like with Jennifer, what do employers do next? We're very excited to figure that out with you, and you too, Greg. So we will go forward with that. But please let me know if you have any questions.
Thank you. Can everyone hear me? Okay. Good afternoon. I'm Lynn Gall, and I am with the state of Wisconsin. I'm the Family Caregiver Support Programs and Lifespan Respite Program Coordinator, Manager for the state of Wisconsin. But I'm here in that role today, but I'm also here as the co-chair of an employer engagement group for the Wisconsin Family and Caregiver Support Alliance. This is an alliance, we just hit our 5-year anniversary. These are people who came together. We're all doing this in addition to our jobs. Nobody got paid extra. We don't even have a budget. We don't, nobody gives us money to do anything. We're just people who got together and did this, and I'm glad we're still together 5 years later. And we have quite a few of these people out in our audience today, so thank you for being here. Our employer engagement group was identified shortly after we formed as something, we said employers and working caregivers are both two groups of people who would really benefit from what our alliance was trying to do. So like some of the other people here who were talking, we have done a couple surveys in the last couple years, and it's really interesting that this UW Madison, UW Extension survey has been the one that it's been around. Actually, we were promoting it 10, 15 years ago, but there were a few nibbles. It wasn't really an issue that people were too interested in, but now we're finding, wow, with the working shortage, the worker shortage and caregivers struggling, it's becoming more and more prevalent. So I just want to make sure that everybody understands that the survey we've been talking about, the UW Extension Working Caregivers, Employer and Working Caregiver Survey, is free for any of you if you want to use it in your state or give it to your employers. It's an anonymous survey. People take it anonymously, and you can collect data. And really, the reason I'm pushing this is because not only it's a free resource that your employers in your state, I think, will appreciate, but it's anonymous, and it is really the first step to understanding, for any company to understand what's going on. People think, I think a lot of companies think, oh yeah, I know who's a caregiver in my workforce, but it's really, I don't think they know. People are afraid to come forward and say, I have these other responsibilities outside of my job, for fear of what it means to their ability to keep that job, to get a promotion, to get a raise, or whatever. So there are a lot of reasons for not sharing that with your employer. And this particular survey lets people answer that anonymously. Nobody will ever know that it's them who said that this was them. So the other thing, with our group, when we did our survey, we realized that this is really an issue, kind of an underlying issue for employers who are saying, wow, I'm having trouble recruiting people or keeping them. 25% of the people who they're trying to recruit or retain are caregivers, and that's a huge amount of people. And if they're not aware of that and aren't addressing that in their policies and procedures and the way that, and benefits that they provide, that's going to be a big problem for them, not only at the moment, but further down the road. So I'm very happy to have both Irina and Diana here with us from Madison today, from the Promega Corporation. They've been with us at a couple different, we call ourselves WFASA, Wisconsin Family Caregiver Support Alliance, a couple different WFASA events, like Mufasa, like Mufasa. But they've been with us since the beginning, and it's really important to have a company that is that champion, that is that person who can stand up and speak to other companies and show what the benefit is of doing this, because you can do that in a way that they'll listen to us to a degree, but what's really one company to another company is, and making the business case for it is going to be huge. So next slide. I had really planned on going through some of our survey results, but everybody else has sort of done that. I encourage you to look at our survey results. There's a link to them, but there are also hard copies on our table in the resource room down the hall. So you can we put out a press release, which any of you is welcome to take and use for your own if you wanted to do some promotion of some sort. There's a full report and then also like a 2-page summary of our findings that's nicely with graphics. So please stop by our table and pick that up before you leave. But these are the people who really helped with our efforts. The UW Extension, as I mentioned, it's their survey. They helped us crunch the data and come up with the findings and look saying, what does this all mean? The ADRC one of our ADRCs, their executive director, helped us, and Wisconsin, which is a Wisconsin organization that is caregivers, siblings of people with disabilities. Their executive director, Harriet, sitting right in front of me here, is about to retire, so thank you, Harriet, for all the work. She's my co-chair on the work that we've done. My department, Department of Health Services, Respite Care Association of Wisconsin, and again, GWAR, who we've talked about. I just want to make sure that they all get their credit, and that understanding that having them, we couldn't have done this without all of those different perspectives and people coming together to help make this happen. So next slide, please. This is where we're going to go over some of the things that we knew and didn't know, but we've kind of talked about that. I think what I'd prefer to go on to is next slide. 8 in 10 of the people that we did survey told us that they were affected by caregiving. Those are the working caregivers, which may not be a surprise. Continue, please. Just some of the statistics. People, you've seen these. I think these are pretty normal, but ours said that 23% of the people who took our survey said that they considered taking, just leaving work completely. And I think anybody who's an employer, if knowing that, saying, okay, 23% of your workforce is saying, which matches about what I said in the beginning about 25% being caregiver, the 23% are just like saying, no, this isn't sustainable. I can't keep doing this. Something's got to give. Next slide, please. Some of the comments people said were just never knowing is so stressful, but I'm lucky my boss is fantastic. Others say it was used by an excuse by my supervisor not to rely on me. They would reassign work, even though I put in many extra hours. My employers say that they promote work-life balance in words, but not in actions. That was some of the responses we got. Next slide, please. And people saying, I always feel like I have to make a choice between what's more important, my care recipient, my husband, wife, whatever, or my job. And 56%, like I said, they just indicated that their current situation was not sustainable. But the good side, the flip side of that is that we also learned that they said it wouldn't take that much to make it sustainable. Just a few extra hours a week or a little help would be enough to help them make it. Next slide, please. We did ask some questions like other people. We started this right before the pandemic, but we didn't do this because of the pandemic, but we thought, well, we should throw that in there. And overall, what we found out is As you would expect, the caregiving became more and more difficult during the pandemic. Thank you. Point to me, where am I supposed to be? Yeah, half of them said that their caregiving responsibilities increased during the pandemic. So next slide. So what we're trying to do in Wisconsin is really what we want every employer to really understand, first of all, that there are free and available resources out there, not only Respite, the family caregiver supports, community organizations, community programs that they can use for free. When we approach them and talk about increasing caregiver supports, we don't mean necessarily having to spend millions and millions of dollars for a new benefit package. That we hope that every employer in Wisconsin knows that aging and disability resources, those centers are out there, and that they can include them as resources that they can give to their employees, that they refer their employees to us. We're there for them, and we're their partner in this. So that's one of the main things we want companies to understand. And number one, as I said, finding out, we would tell an employer to find out how many of your employees are actually caregivers. Try to create venues to explain what those resources are. Have the ADRCs or other community organizations come in and do lunch and learns. Or just do them any time. Maybe it has to be on-site, off-site, caregiver support groups, whatever you might want to do there. And then ask employers to consider what would work for them. When we were putting together our survey report, the UW Extension said, well, it's like, okay, you do the survey and you put all this information together, well, now what? What are you actually asking the employer to do? And so we put together a very simple worksheet, just basically to get them to start thinking. Here are a couple questions. And very simply to say, what could you do? What are you doing now? What could you do more of? What have you thought of doing? What resources do you know of? What more do you need? And to get them to really start walking through it, and to maybe sit down with others in their company and their organization to start saying, what could we do differently? Because we understand completely some employers are more flexible than others. But there are some jobs that if you're in the service industry doing hourly work and you're running a cafe, you have to be there. I mean, there are differences in that, and so that's why I think that approach of like what different employers can do, but there's usually something that can be done. It may not be the same for everybody, but somebody can probably do something. And to really get them to start thinking about that. And training the HR staff in a company, I think, is huge, to have them be not understanding about caregiving needs and to be connected to those resources and to have some empathy, because I just think that's really, the person has to be able to come to you and feel safe, that I'm not going to put my job in jeopardy, because those caregivers, we want to keep them in their jobs because they need the money and the businesses need the workers. So it's in everybody's best interest to keep them working. And if we're not open and honest about what we're doing, I think you can end up with somebody either being fired or leaving, and neither the company or the caregiver really gets what they want. Everybody loses. So that's our goal. And just to let you know, on this slide, it's kind of if you keep clicking, there you go. So yeah, it'll give a few bullet points, which I just went through, so you can just go through those. But so in summary, I guess that's make sure you know how many you have. I encourage you all to take a look at that UW Extension survey and use it in your states. And just know, let me see here, and use the worksheet. Look at the worksheet we put together to start having that discussion too. And it doesn't have to be high level, doesn't have to be difficult, but just start thinking about it and making the business case. So again, thank you very much for listening to us. And
well, thank you for having me. My name is Diana Clark. I'm the benefits manager at Promega, and I'm going to give you a break from slides. You just get to look at our logo while I talk. Because this is not, my portion of the presentation is not as data-centric as it is our experience of how we got to the point of acknowledging the need for caregivers, to finding a program and designing a program that we felt might fit, and how we've modified that over the last 6 years that we've had this program in place. So for Promega, caregiver leave is a paid time off program. We offer our employees sick, vacation, and personal PTO banks that they can utilize, but this is a separate bank of time that they can access. So I think that's a key feature that it's important for employers to be aware of, because family medical leave is a wonderful job protection, but it was not coming anywhere close to meeting the needs of our caregivers because they couldn't afford to take it. It's unpaid time off. So the first thing that we identified when we started looking at meeting this need within our population was the need to create an entirely separate bank of paid time off for these caregivers to utilize. As we started looking at the program, it actually started during a different type of committee that was talking about the need for paid parental leave. And that conversation was broad and open and loud and interesting at times, because our benefits philosophy at our organization is to meet the needs of the broadest possible demographic within our population, to be inclusive. And as we looked at this, why we were needing to meet needs of new parents, we said, well, that's also true for these other individuals. A person that's caring for a spouse with a temporary need to recover from surgery, a parent who's caring with a long-term serious health condition, a person who's caring for a parent who has a loss of independence due to just the natural course of aging, or many of the medical conditions that come along with that natural process of aging. So that's where we pivoted way back in the beginning when we were looking at paid time off programming, that parents are just a small part, an important part of our workforce, but there was a bigger need that needed to be met. And so we decided to look at a paid time off program for a caregiver, and within that program, recognizing that parents are caregivers, especially when they initially have a baby or adopt a baby or foster a child, adopt a child, establish legal guardianship for a new child in their life. That is a moment of becoming that new caregiver, and that also needs that paid time off. So we started in 2018, and I'll be honest, we started with 2 weeks of paid time off because in the employee benefits world, there are some truths that you need to be honest with yourself about, and one of those truths is that once you offer your employees something, once you give them something, you better be prepared to not take it back, right? And we knew that we didn't know how many caregivers we had within our population. Anecdotally, I had had so many conversations with the 1,300 employees at our company and knew that this was a problem. But to put a number on it, this was a scary proposition for me to propose this to our CEO of our organization, because this was not a return on investment that I could quantify, because I had to be honest about the fact that, you know what, a lot of these employees exist, and now there's more great data about 25% of our workforce. We knew those were estimates, and it was a matter of this problem exists, we need to create a solution and then continue fine-tuning as we go. So we adopted the 2 weeks of paid time off, and what we learned is that caregivers came out of the woodwork. People that we knew had caregiving responsibilities, people who had no idea. It engaged us in such rich, meaningful conversations with our employees about what are they experiencing, what makes it difficult for you to get to work, what makes it difficult for you to stay at work, what makes it difficult for you to be present when you're at work. We have a funded medical plan, which as an employer means that we essentially pay the bills of all of our medical employees, or our employees' medical bills. So when you start talking about the stress and the toll that it takes on caregivers, that also is impactful for us as a business. So acknowledging that we had a vested interest in caring for these employees in the same way that they were showing up and caring for us as a business. So we incorporated this into our existing leave processes. We did not try and recreate the wheel, create a whole new process system. The leave of absence process in place. The key was communicating the flexibility of that process. As you mentioned during your conversation, they think that whereas leave of absence can be intermittent. It can be reduced hours, depending on what need may be for the individual caregiver. So showing that flexibility of saying continuous paid time off may not be a meaningful benefit, letting them know over a year, have 6 weeks of paid time off, that flexibility. I'll just my volume and bear with me every time it cuts out. How's that? I've never been a wallflower. I'm not worried about not having communication was a huge part of rolling out this program. Not only sharing what we were doing, but helping people to identify that this applied to them. Can I trade you? Thank you. Yay. Big applause. Thank you. I appreciate it. Communication was a huge part of our rolling out this program. For those of you who work in this industry, you probably aren't surprised to hear that getting people to understand that we're rolling out a caregiver leave program, by the way, tap you on the shoulder, that's you, right? We didn't think we'd have to tell people they were caregivers or explain to them what that meant. We thought if we explained what our definition was of a caregiver, that we would have 20 to 25% of our population raise their hand and say, oh, wow, that's me. It's not that simple, and it's not that easy. So you have to explain what a caregiver is and how and when and how and why this applies to them. We also had to explain to caregivers that you don't have to be administering medical treatments in order to qualify for this time off. That making meals for your loved one, helping them get dressed in the morning, providing psychological comfort by sitting next to someone with dementia is a meaningful caregiving activity. You don't have to prove that you're transporting them back and forth to a scheduled appointment. You can just be there for that person and provide the day-to-day life activities that they're struggling with. We changed our employee assistance program provider during this time, and one of the things that we asked each of the people that we were considering, the vendors we were considering, was what do you do to support caregivers? How can you help us continue to meet this need? And what we found is that one of them was a real standout because they actually were delivering these types of services. They not only provided the counseling, the free counseling services that all employee assistance programs provide, but they had a whole second prong of services that they offered to caregivers, saying, do you need to find a respite caregiver for your loved one? Do you need to help transition mom from home to assisted living? Do you need to evaluate assisted living centers in your area? It was amazing the number of things that these professionals could help with, and essentially extended our benefits team by bringing in this particular vendor. There was a learning curve, and still is, for how to support caregivers. As you touched on during your conversation, caregiver is not a one-size-fits-all label. Caring for a child with a peanut allergy is very different from caring with a parent with dementia. Caring for a spouse with PTSD is very different from caring for a sibling with alcoholism. These are all wildly different journeys. And what we did recognize is that we needed to take the time to make our program flexible enough to fit and work for everyone. We had to train our leaders. One thing that I was amazed when we initially launched this program and proposed it, we went around to our leadership teams and had conversations with them and said, how do you feel about this? We're looking at doing this. Do you have concerns about us offering an additional 2 weeks of paid time off for employees in this situation? And one of the things that surprised me that I heard most often was, no. And you know why? Because they're already doing it. They're burning up their own sick time. They're doing this even without the paid time off. They're burning their sick time balances down to zero. They're doing this on nights and weekends and before work and after work, and they're missing work for unpaid time. You're not increasing the amount of time that caregivers have. You're easing the financial burden that these caregivers carry. And having a supervisor acknowledge that, the one that's actually going to have to cover for the work that's missing, was huge to understand it's already happening. You're putting your finger on something that's already there. So our program went from 2 weeks in 2018, and in 2021, we reviewed the data and realized that this is working. We are connecting with people. We are finding value in the program. We increased it to 3 weeks. Then we really started looking at the data and really started looking at what a difference this had made in our employee population in the first 3 years that we had rolled it out. And we decided this summer to go all in. From our perspective, it felt all in, and move this from a 3 weeks of paid time off program to a 6 weeks of paid time off program every 12 months. So for people who make that commitment to care for someone, and this is not a condition that's going away, they know I may be caring for this person for 3, 5, 10 years. Employees at our organization know we've got your back. We have that additional 6 weeks of paid time off. You can be compensated for this time. We value what you do. We want to provide you with additional resources. Please connect with us. And by the way, we're going to give you this every year. Some of the benefits that I would encourage, that I continue to share with other employers and encourage employers to look at when they consider this type of program, is you don't know what you don't know. You have caregivers among you. You have the 20 to 25% of your population that's doing this, and because you've never asked the question directly or given them a safe place to share this information with you, that's why you don't know. And once you create a safe place for people to share their journey with you, their experience with you, and to partner with you to help support them, then you'll start learning the situation that exists within your organization. Only once you know can you evaluate and support those needs. We thought in the beginning we had to figure everything out and then roll out this great program. Well, we didn't have the information, so we rolled out the program first and said we'll figure out the rest later. Not every company can do that. We're pretty flexible as an organization, and I appreciate that because we have the latitude to do that, to say we're going to put this out there first and then have meaningful conversations and figure out the rest as we go. And we continue to do that. Last but not least, I want to focus on how employees have engaged with this program, not just our caregivers, but other employees who aren't currently in a caregiving role. What we learned since 2018 by opening these conversations and by normalizing having these conversations in the workplace is that there are compassionate people among us who want to do more to help. And by opening these conversations and sharing our stories, we created a whole nother network of support within our organization. Our employees themselves created what's called a Circle of Caring, which is a list of over 200 volunteers that I can email at any time when I have these conversations with caregivers and anybody initiating a leave of absence. If I find out that they could benefit from a meal train, having meals dropped off at their home while a partner's going through chemotherapy, or from some lawn care services. We had somebody who cared for their spouse until they passed away and then was gone for a period of bereavement. And our CFO showed up and mowed her lawn, and we all signed up for time periods where we could go and help with lawn care. Someone who's caring for a sick parent, and we live in Wisconsin, let's be real. I mean, sometimes we get dumped with 8 inches of snow and y'all are trying to get out to work the next morning, right? So signing up to be the person that will show up and shovel for you during the winter if you have additional duties as a caregiver, or if you're on a leave of absence. Our employees showed up themselves to do that. The biggest thing we had to do was normalize having this conversation. So that's the biggest takeaway I have for employers, is that starting the conversation is the most meaningful. And I thank you for inviting me here to talk with you, and I thank you for all of the work that you're doing within our communities to help make this burden a bit easier.
Well, thank you all for providing a bit of orientation to what you are doing, have done, are experiencing. I think I'm going to ask a few individual questions, and then I have some questions I'm going to go down the line on, some things for all of us to answer. But first, Greg, I'm going to start with you, and I'm going to put on my state budget hat and say, oh, so you're telling more people about the programs. Isn't that going to cost us more because more people are going to want programs like Respite?
Yeah, and I would argue that we already have more than enough money in a variety of systems. Like I said, we have 130,000 caregiver and respite programs. I think we all know, working in the industry, it's a crisis-driven industry, right? I am hopeful that through the data that we collect, through the Raise Council recommendations and many of the other moving pieces, that you get not only the political support, broad-based, for caregiver and respite care across the age spectrum, but then that leads to investments. Now, not all investments are bad investments. If you can invest $1 here and save $10 there, that's a really good investment. It's a return on investment. And so I think a lot of the types of data that you guys have shown and that we know to be true warrants that, right? We have a very reactive healthcare system. We wait for people to get so sick they don't recover, and it costs a lot of money. We know these, very low budget front-end prevention things, like what we're talking about here, and many, many others, really make an impact. So I think you got to look at the big picture and kind of aggregate, some of that data. But if it winds up being investments because you built that, political coalition, more power to us.
Incentivizing caregivers to move to New York is what I hear happening. So Kim, when I heard all of the work you're doing engaging with employers since 2015 and probably before that, what have you heard back from employers as they've, let's say, even learned what respite is? Like, what does some of that conversation look like?
Right. Well, overall, it's been very positive. It's really amazing to me. All different kinds of quotes, and we do include that on some of our surveys and things, but even like, wow, we had no idea. We had no idea respite even existed. But also just great feedback, like if this is a way that I can support people on my team, I absolutely want to do that. Or is there any additional information that I can share with them? So it's really been very positive, very encouraging. I know it can be hard for any of us if you get a lot of negative feedback, you take it personally, you don't want to keep going. But a lot of times these employers make me want to keep going. And even, I didn't mention this, but we have a work plan goal of how many employers we need to reach. But it's amazing to me, we've exceeded those goals because one employer will tell another employer and tell another employer. So that has been great for us as well.
So Lynn, I saw on your slide you had all those logos for the WFASA. And it seems like you have a great employer champion right here with Promega. Can you speak a bit about how you're collaborating and bringing these different partners to the table?
Sure. Well, as I said, our alliance came together really 5 years ago with this idea of just the aging and disabilities that we talked about. A lot of times that we're in silos, but there's really so much crossover. And so bringing them all together under one, even the fact that I just took on the Lifespan Respite program after working in family caregiving support for so many years, it's like, okay, we're going to move this over here now because it makes sense. It's all one thing. So these are natural partners who I think are working together and feeling the same frustration of being a little bit marginalized or like not having the connections that we wanted to have. So getting together in this WFASA, in our alliance, really gave us the opportunity to work together and make things happen. And with the employer engagement, the fact that as a primary thing we wanted to work on, to me says a lot too. When we started looking at, if you're familiar with that, Harvard Business School has got a whole initiative of managing the future of work. That was sort of like what we looked at. They've got some nice information out there. If you haven't looked at that study, look at it, and they got videos you can use for your own promotional reasons. But yeah, I can't say enough about our partners. And like I said, we found the UW Extension survey that was around 10, 15 years ago. What's old is new again. We find out New York is using it, Nebraska is using it. We're just like, wow, what do you know? Maybe we should be using it too. So, It's just wonderful, and the partnerships with everybody here too. So that's all I can say is reach out and the partnerships too with employers, and if you can make those connections. I admit it's hard to struggle from us. We have a different point of view. We're health and social services sort of people, right? So businesses look at it differently, and so when we approach them, we have to know we're coming at it. We got to be able to make a business case. We need to come at it in a way that is going to talk their lingo, what they care about, which isn't always. They should care about the well-being of their employees, right? Yeah, but they have a different bottom line than we necessarily do. So, and doing this work really makes us have to shift a little bit, and I think that's really important to involve as many different ways of looking at things as you can when you do that.
Diana, I'm going to ask you a question about the challenges and barriers. So from your perspective, reaching out or accessing supports, and from your perspective, Diana, setting up those supports. Because you guys made it sound amazing. So now I want to hear, what were the roadblocks?
Well, from my perspective, the main roadblock was management. Management, not very supportive from a personal perspective, but really not knowledgeable or willing to do anything from the paperwork perspective. I don't even, I had a manager who just retired, but he was at Promega for 30 years, so it's not like a lack of knowledge. It's literally just did not want to deal with it. And again, I can't say anything. That very supportive personally, take as much time as you want, but let's not file any paperwork and just keep it, our little secret. So that's the only thing. But which means that you realize that you are not protected because you didn't file FMLA, and then HR does not know that you're a caregiver, and they are not going to approach you, right? Because Diana knows that I shared an office with a person in exactly the same shoes as I was, and if we didn't talk to each other, we would not know half of what was offered, because she got a little bit from somewhere, I got a little bit from somewhere. So that's the main thing. It's not even lack of information, but it's not knowing where to look for it.
One of the challenges is that supervisor manager buy-in and engagement, and this is one area where in our organization we've seen the flexibility can be a real double-edged sword, right? Because I have the flexibility to leave work early or to come in late, and so I don't need to reach out about this caregiver stuff because I can just flex my schedule around it, and not knowing what you might be missing out on because you have enough flexibility. The hybrid environment that many of us have functioned in during the pandemic has really only exacerbated that, I feel, for caregivers, because many of them were working at home and caregiving and maybe not getting any respite. They can't even go to the office for respite anymore. And during a time when they're getting further isolated from potential resources that are available to them, and feeling that internal pressure of, I'm at home, I should be able to do this. So I don't need somebody else to come in because I'm already here, I can just do this. And so some of it is trying to imagine, put yourself in that person's shoes and help sell that benefit of why the paperwork is worth it.
We all have experienced various things related to the COVID journey that we are still on. But one of the things that maybe is a bit of a silver lining is some of this increased awareness and understanding. And some of it is the flexibilities that have been created, the engagement around what does care mean. So I'm going to ask us to end on an optimistic note, which is, what brings you the most hope coming hopefully soon out of COVID, that we can see a change for working caregivers?
I actually have to say that for me, COVID was made my life easier, and the flexibility. I mean, I worked in a position and at a company that's extraordinarily understanding and flexible, but at the same time, before I had to still explain why I'm not showing up today. I'm going to take a day for working with whatever documents at home, and now it became, I don't need to explain myself. And even though, again, everybody understands, but it's, you probably know that every time I have to approach my supervisor and tell him I'm going to work from home, and I'm going to be notebooking or something, and that's an extra hurdle that is not necessary. Now, I appreciate that. So COVID was actually beneficial for me.
I feel very optimistic, I have to be honest. I think that, you know, looking at COVID for the work that we do in our network, we've known what we've been doing for 50 years, and it was the first time I think it was recognized from the highest levels down to the lowest levels of the community. And so, you know, when you think about things like the RAISE Council and the recommendations and the Master Plan on Aging, we have a Reimagined Long-Term Care Task Force, we have all kinds of councils, and the opportunity really to raise these levels and bring them into something that crosses all agencies, whether public and private, but really matter to people. And you talked about, you know, you just showed some of the press clippings. You see those every single day. And the business community has a lot of clout in the political community. And so if we can make these types of issues relevant within business, you're going to see an accelerated move towards solution-oriented solutions.
Well, I feel like, oh, am I on? I feel like mine is kind of a very straightforward piece, but when we developed our Respite Employer Engagement Initiative, we wanted to do this. I developed a PowerPoint, and I was reaching out to employers and having webinars and conference calls and things like that, because part of our state funding also is there's very little money for travel. So being able to travel and reach employers in person was really not something that we weren't even creating our model that way. So just to be the most sustainable, but post-COVID, oh my goodness, every employer is accepting, you know, Zoom meetings, WebEx meetings, you know, doing things virtually. So that has made employers even more engaging or willing to participate in whether it's respite employer engagement or learning more about our working caregiver survey, both sides of those things.
I would have to say what COVID made me most optimistic about is it really raised the issue. It put caregivers into a spotlight. They're, like I said, they're just sort of this invisible workforce that does 80% of the caregiving work in our country, who never really gets noticed. And boy, during the pandemic, did they get noticed. So going forward, I look for opportunities to try to do something with this national family caregiving strategy coming out. Really, really looking forward to being able to raise issues in there, everything from the caregiver issues to the economic security of caregivers, to there's just so much in there, and to be educating our legislators about it, because I don't think it's really been on a lot of legislators. They just think everything's going fine, right? Families will take care of it, and they don't really need any help, sort of thing. But I think the fallacy of that was kind of laid bare during the COVID pandemic. So I'm looking forward to opportunities to have more discussions about that and educate people, and hopefully bring some of those things that are in the national strategy into a new light and bring them to reality.
But keep in mind, I am the benefits manager within HR. So I have to say that COVID and the subsequent tightening of the labor market, for me, gives me hope, because it's forcing employers to be more competitive. It makes employers more willing to spend money on programs to support their employees, to acknowledge that they need to prioritize work-life balance, that they need to provide resources for the people who are showing up to work every day. And so to me, the tight labor market itself is going to force more employers to step up and do the right thing, and provide great services for employees in need.
Thank you. Thank you to all of our panelists. It's been a fun conversation, and can't wait to see what we do in the coming years. Thank you.